Okay, no more noises, Joel. Thanks everybody for joining us. No, thanks so much for joining us, Joel and Jim.
Thanks,
Ray.
For having. Yeah,
hey guys.
this is the issue with having multiple people on. Let's try that again and just yell it out at ready. Okay, I'm going to start this over. Thanks so much for joining us today, Joel and Jim.
Hi, glad to be here.
Hi guys. I know both of these lovely gentlemen outside of this podcast, so it's really exciting that my different worlds have collided here. Let's start today. Jim, your story has brought us here. So if you could tell us a little bit about your spinal cord injury and the healing process and what led you to the healing that you found through psilocybin.
Yeah, that process started for me in November of 2014. I broke 9 vertebrae while on a ski expedition in Patagonia in southern Chile. And eventually I returned back to the United States just over a week after the accident. My injured, damaged spinal cord was decompressed and 5 of the broken vertebrae were fused. I spent about the next December through April as an inpatient in various hospitals, and then continued outpatient therapy for a few months after that. And then through that time, I've gone from being completely paralyzed to beginning to regain some small amounts of function, whereupon I transferred to Craig Hospital and went from over a few months from being able to wiggle a toe to be able to walk with a huge amount of assistance, and then gradually less and less. And so I was already having a pretty remarkable recovery from a spinal cord injury, which certainly isn't common, isn't ubiquitous, but it's really not terribly rare either. And Craig Hospital in Denver tends to specialize in spinal cord and traumatic brain injuries, and they seem to maybe cherry pick cases somewhat for people where they think they can make a difference in maximizing that recovery, which requires some financial resources, but also a huge amount of time and effort on the part of both the patient and the rehab team. And so I was in the midst of this recovery from the spinal cord injury, from the severe injury. I'd moved to Northern California to continue pursuing physical therapy with a nonprofit called High Five Foundation there. And so this is maybe about 8 or 9 months after spinal cord injury. A woman who I'd worked with for months, who had been assigned to me as a physical therapist, came out to Northern California for a music festival. I joined for a couple days. I was really sober throughout this music festival, where there was a lot of cannabis use, a lot of drinking, a lot of recreational substances all around. Very high rate among the attendees at this festival, very high rate of recreational use. And maybe on like day 3 of this 4-day festival, I had half of a psilocybin mushroom chocolate. And from this moderately altered experience, like it was more than a microdose, but also still very grounded in consensus reality. From this moderately, mildly altered experience, all of a sudden had a sudden return of voluntary motion to support the muscle groups that hadn't worked in the 9 months since my spinal cord injury. And so that led me to that sort of like very, very sudden change led me to being quite curious about what that mechanism might be, and if there were other cases like mine, and if there was any sort of allopathic neurogenic understanding of what might be going on. And and that's where Joel comes in.
And that's where Joel comes in. And I'm looking forward to getting to Joel again. And for those who missed it, Joel and I did an episode about a year ago on, I want to say it was Psychedelics and Pain. There have been a lot of episodes, and Joel has been kind enough to come on some of the PMA webinars as well. So just a question to clarify, and this is I'm just trying to imagine putting myself in your shoes. How rapidly did you regain some of these muscle group functions? You said, pretty suddenly. Are we talking like minutes, hours? What did that look like?
So for the period of my rehab up until that experience, the pattern of regaining voluntary muscle use tended to start with involuntary muscle contractions first, with like some strong spasticity for me, which isn't ubiquitous among spinal cord injury patients. Some people have muscle tone and spasticity and clonus, and other people don't. And in some cases, that muscle spasticity precedes a regain of voluntary function. So I would start off with involuntary muscle movements, and then would, over a period of days or weeks, be able to maybe start contracting a muscle voluntarily, where like would think of it like almost like shouting inside my head, like focusing, like a very strong attentional focus, all attention focused on trying to flex one muscle, sort of like that activity of someone tells you to put your hand flat on a tabletop and then to lift just your ring finger, and how you can really concentrate very hard on that with very little movement against gravity. And so for me, there'd be these like flickers of muscle contraction that would feel voluntary, but then it would often take a lot of repetition before that contraction was functional in any kind of a movement pattern, or being able to like lift a foot off a bed, for instance.
But then what was it like when you took the psilocybin? What was did that same pattern happen, but very rapidly? Like, are we talking?
Yeah. So,
yeah.
Well, so this is like, it felt quite different in that, was outstanding in a field with a walker, and all of a sudden had an ability to contract my hamstring, and this ability to contract my hamstring and lift my heel off the ground, like up towards my butt. And I hadn't been able to do that up until that time. I was walking, but my left leg muscle functionality was much stronger than my right side. And so I would sort of just drag my right foot around. And at that point, I'd been ambulating that way for maybe 2 months or so, and like wearing through a pair of shoes every few weeks, where the left shoe would still be brand new, and right shoe I would just drag a hole through the toe from pulling that foot behind me. And all of a sudden, I very rapidly gained this ability to clear my right foot. And fast forwarding in time, that's still a muscle group that is quite weak for me. Like, it still takes extra degrees of concentration to really control it. But that voluntary control never went away after that. So it seemed like somehow my brain discovered a new pathway.
Oh, very cool. So let's bring Joel into this. So you have this realization, and then how did you, I guess, of all the people that you could have reached out to, how did you find and reach out to Dr. Castellanos? And what discussion did you guys have at that point? We'll start with Jim, and then we'll throw to you, Joel, for whether or not this is something that a lot of people have reached out to you. So Jim, how did you find Joel? Yeah.
I found Joel through a mutual friend named Court Wing. And Court and Joel were coordinating on a seminar about psychedelics and pain, and Court invited me to listen in. But I think this is really the first time that Joel and I have talked. I think on that seminar, I maybe asked him a couple questions that I think maybe he smiled at me and told me that was a second or third order degree research question. Yeah, and so that's the extent. This is like the first conversation we've really had about it.
Yeah.
Give it to us, Joel.
So, I mean, my background, for those of the listeners who don't know, I did my residency training in a specialty called physical medicine and rehabilitation, PM&R for short, where we are tasked with, partnering with patients who have suffered either spinal cord injuries, brain injuries, strokes, amputations, and really being a resource for them to guide them through their functional recovery. All of or at least most of the physicians at Craig Hospital are trained in physical medicine and rehabilitation, and most of them have subspecialty training and board certifications in spinal cord injury or traumatic brain injury medicine. During that process for me of training in PM&R, I became really fascinated with the idea of neuroplasticity and how we leverage different ways of unlocking neuroplasticity to help patients regain function. Through all of that, I also discovered that a lot of these patients have chronic pain, a lot of times neuropathic pain, which led me to get further training at UC San Diego in the pain medicine fellowship. Since then, I've also become board certified in traumatic brain injury and done a fellowship in integrative medicine. So I don't know if I'll ever be done with learning or trying to get more letters behind my name. That's not why I'm doing it, but it just seems to happen every time I do it. But that being said, my primary focus is on neuroplasticity and ways that we can creatively modulate the nervous system to optimize recovery and optimize quality of life, whether that's from a pain perspective or a regaining motor strength perspective. And the idea that psychedelics through serotonin receptor 2A agonism can unlock some of these pathways to allow patients to regain new levels of motor recovery, change ASIA levels. The ASIA classification system is how patients who have suffered spinal cord injury are classified based on how much recovery they have gained. If we can demonstrate that through psychedelics we can optimize and improve and make recovery more efficient, it is something that will be a huge deal for a great number of patients, and make my job as a rehab physician easier. And I like it when my job is easier.
I appreciate that. I think we all like when your job is easier, because that means that healing is happening faster and through other means. And I volunteered in physical medicine rehabilitation. I know how difficult some of the challenges you all face are. So it's very exciting for, I think, everybody involved in the field or who is affected by a spinal cord injury, if this can be an area that is promising. So Joel, has anything research-wise taken place specifically focusing on any type of paralysis and a psychedelic?
To my knowledge, nothing of there's been no clinical studies, no randomized controlled trials. When I was on the REMAP symposium with Court, and Jim asked, the questions about its efficacy in spinal cord injury, I did smile, because it's an area that I am most passionate about. I think I got my window in to the space of psychedelics through pain, and I still am very interested in pain. But I think if we're able to really investigate how much we can leverage psychedelics to open up the neuroplasticity that it may infer, the benefit to patients is going to be huge. And if we can, because one of my main focuses is on neuroplasticity in general, I want to try to investigate all of the potential mechanisms, not just psychedelics. I think that there's also some really interesting research going on right now with the use of vagal nerve stimulation and opening up different mechanisms of neuroplasticity. The theory behind vagal nerve stimulation is through a completely different mechanism that is more dopaminergic versus serotonergic and BDNF alpha with psychedelics. So, you know, when I read that there are different mechanisms of turning on neuroplasticity genes and opening up pathways towards neuroplasticity and new motor learning, I'm like, great, let me find a way to combine vagal nerve stimulation and psychedelics, and I'll even throw in transcranial magnetic stim just for good measure, and we'll get every patient walking again and not having to deal with neurogenic bowel and bladder and spasticity, because these are, Jim, as you know, these are the type of things that patients who have suffered a spinal cord injury deal with on a daily basis, and they're things that are not necessarily talked about or highlighted in mainstream healthcare. And it's a thing that a lot of providers, primary care providers especially, don't really know how to aptly manage.
Yeah, Jim, do you want to speak to that at all? Because I totally second what Joel is saying. I was a primary care doctor. We are not at all taught, equipped how to address, because a lot of people, when we think spinal cord injury, it's the things that you see that you think about, oh, they can't walk or they can't move their arms. It's the physical things. But like Joel just alluded to, there's a lot of, bladder issues and bowel issues and those kinds of things that are also affected when the nerves are interrupted. So, did you notice any improvements if you had any of those types of symptoms?
So from my experience, I really appreciate Joel's perspective of looking at taking a more holistic approach. And I really appreciate the pragmatism he's expressing in looking at all different sorts of therapies. That's certainly been my interest. Like the reason I've become interested in psychedelics as medicine has been from trying to figure out like what are all the levers that what are all the ways that I can have some sort of personal efficacy in my own recovery, and trying to determine that. And so I felt some real misgivings when that article was published recently in Outside Magazine. The article itself was great. The headline was quite hyperbolic. It was something like Jim Harris was paralyzed and then he ate magic mushrooms. And it's like, there's on one hand, I think that the article probably got a lot of eyeballs that maybe it wouldn't have if it had a really nuanced, here's a thing that might have a small effect or even a moderate effect for some people and for some unexplained reasons. An accurate headline probably wouldn't have gotten the same readership. And to your point, Lynn Marie, there's a huge amount of variety between spinal cord injuries. So there's one of the difficulties, as I understand it, for Western medicine is that it's very hard to give an accurate prognosis for anyone's injury. There's currently not a way to image an injury lesion in a way that will give a very accurate prediction of what that person's recovery might be like. And so because of that, and I imagine because of the pressure of patients feeling quite anxious of wanting a definitive answer for what their recovery might be, there's a lot of people that are told they won't recover, they won't walk again, when in fact, maybe they later learn to. But I think maybe a lot of people don't give up hope. Like the rebellious personalities are like, F you, watch this. But a lot of patients, I think probably myself included, would be somebody who's much more inclined to listen to the voice of an expert, like the voice of a neurodoc saying that like there's not a reason for hope. And I think in my case, no one ever told me that, even though one of the best predictors for recovery from spinal cord injury is how quickly blood flow is returned to the injury site. So patients who enter an operating theater within a few hours tend to have much better outcomes than patients where it's many hours. And after about 24 hours, my understanding is the urgency often kind of ceases. The thinking that whatever ischemia has limited blood flow has caused the permanent nerve damage that won't be reversible. And so the fact that I have had a really significant recovery from spinal cord injury, and I was like 8 days to definitive care. I think that data point alone makes my case like a unusual and unlikely one. But also just kind of highlights how diverse the symptoms can be between nerve pain and spasticity and bowel and bladder function and sexual function. But I do know of other anecdotes kind of similar to mine of people, maybe especially it seems like first psychedelic experience, that of people suddenly regaining sensory or motor function. One of those stories is a friend who has a C-spine injury. He broke his neck and is paralyzed from neck down. He's a quadriplegic, and in the midst of a psilocybin experience, regained almost all of his skin sensation. He still uses a motorized wheelchair. He still has limited hand function and really no leg function, but regained like sensation of his entire body. And one of the things he told me is like, oh yeah, after that, like the sex is really good now, which was not something I was expecting to hear from a guy in a motorized wheelchair. So in that case, it seems like it's a huge quality of life improvement. I know someone else who during a psilocybin experience post spinal cord injury was able to move their legs to walk on a treadmill during gait therapy for the first time unassisted. Since that article was published, a handful of other people have reached out with anecdotes. So on one hand, I don't think it's universal, that it's not a magic bullet that people with a spinal cord injury can take a psychedelic and suddenly experience some sort of recovery. But also some subset of people, some maybe non-trivial subset, have some really interesting kind of almost and very sudden rapid changes that happen. Maybe it seems like anecdotally, like first a psychedelic experience, and then kind of secondarily to that, it seems there's maybe some reason to suspect that some of the nerve plasticity that psychedelics can allow may reopen sort of a critical period of this pivotal mental state where, say, having a psychedelic and doing physical therapy in that state, and maybe even the days afterwards, might result in a bigger functional change than just doing the therapy on its own.
That's very interesting. And yeah, Joel, if you'd like to comment on that, I see you're nodding your head.
Yeah, I mean, a lot to unpack there. I'm really curious. One thing I just want to kind of ask, Jim, in your experience, because there's overlapping mechanisms and pathophysiology between, how psychedelics work through the serotonin 2A receptor, as well as the pathophysiology of spasticity and kind of pathologic increased muscle tone secondary to a lack of descending inhibition. In your experience and with people that you've talked to, is there a commonality between, taking psychedelics and first having more involuntary muscle contractions? Is that something that you've experienced personally or heard from people?
Yeah, absolutely. I think that's something that I do get more spasticity from psychedelics. As time has gone on, I have experienced less of that with subsequent experiences, and I'm not sure if that is how much of that is a degree of some of those muscles continuing to get stronger, and how much of it almost sometimes feels like it's become a less strong effect for maybe, like, I'm not sure how to
like you're building tolerance almost?
That some sort of tolerance has been built or some sort of mechanism has been learned. But yeah, I think spasticity is really some sort of mechanism has been learned in a way that hasn't been voluntary or conscious.
But
I think that.
Oh, go ahead.
Oh, I think I know this isn't medical advice, and your audience probably isn't paraplegic, but I do think from a harm reduction standpoint, that's probably one of the things that's worth mentioning, that spasticity can be very bad for some people. It's another thing that seems to vary a lot from case to case. Some people, I know paraplegics who have no spasticity in conjunction with psychedelic use. I know other people who it seems like it's quite severe for. And I think maybe especially for someone who's psychedelically naive, as they say, is perhaps especially prone to have a really bad experience when it's defined by like a 3-hour long Charlie horse.
Because I was going to ask what the period of time around the psychedelic journey that the spasticity lasts.
For me, it seems to be like kind of during the like 30 to 90 minute window, like that, and around that first 1 hour mark, kind of in the come up phase. Yeah.
And I also wanted to ask, and I think Joel, you might have kind of hinted on this a little bit. Obviously, you do this the first time, you have this incredible amount of recovery, and then you alluded to the fact that you have done it again since. Has the recovery, is there additional recovery each time that you can notice, and is it less, or what are those subsequent? Because you also specifically said that other people that had come to you had pointed out it was their first psychedelic journey that generally led to this improvement. So what are those subsequent journeys like?
Yeah, so I think for the subsequent journeys, I haven't noticed like really sudden acute changes in something that hadn't worked suddenly, that I suddenly have sensation that appears differently or movement that functions differently. I have noticed in subsequent experiences that it seems to me, I guess my hypothesis would be that like a useful physical therapy dose might be a lot less than what Johns Hopkins and other institutions are dosing as a therapeutic dose. It seems to me that maybe a really high dose psychedelic experience is going to be harder to stay connected to your body, connected to like doing a task. And it seems like my own kind of personal protocol has been like, can I go and like I can ride my bike better than I can walk. I can kind of push my legs, since most of my disability is like about diaphragm down, kind of like bottom of rib cage down, but I can ride a bike with like stability in a way that walking and hiking is really difficult. And so much of my physical rehab seems to be from kind of pushing that damaged neurology kind of right to its envelope, in the same way that people do with gym training, or really most learning functions are kind of things we are operating at the very edge of our comfort zone or the edge of our ability. And then doing that repeatedly causes kind of the window of that ability to move further and further out. Whether that's lifting a barbell or walking in my case, and riding a bike is a really good way where I can kind of push that ability and not fall over and not face plant. So like my kind of personal protocol has been to have fairly small mushroom doses, but also quite a bit more than a traditional microdose, something like 1 to 2 grams of dried psilocybin, and to then go like ride my bike and go find some empty country road and pedal uphill. And I like to, my right leg doesn't track very well. It's hard to keep my foot on the pedal. My knee, like one knee will kind of move in a fairly circular plane, other knee, like because of kind of some imbalances in how the muscles fire and their sequencing, and the patterning tends to like my knee kind of like flops in and out. And so I'll just use that felt sensation, which for me is kind of distant, and take some like additional attention to tune into what my knee feels like and where it feels like it is in space, and to try and use that as a sort of a meditative anchor, and to try and be like tracking my knee in space and influencing how it wobbles or doesn't. And then inevitably like 10 seconds later, my mind has moved somewhere else. And then I try and use that as a meditative anchor and bring, oh, right, back to feeling what my knee and foot feels like on this pedal. And like, how does my lower leg feel? And kind of continually return to that as I ride uphill for like an hour or two.
Oh, that is very cool. Thank you for sharing your protocol. I really appreciate that. Joel, you had mentioned, I was going to ask you like what you think the exact mechanism, because you were talking about, serotonergic leading to neuroplasticity. So what are, are other psychedelics that happen to have the same neuroplastic effects likely to have similar outcomes? Even if they're, like you said, they might be through a different, ketamine doesn't work the same way, but I know leads to some neuroplasticity. And then also, is there a neurogenesis portion of this that you think might be involved?
Yeah, so there's a really interesting paper that came out of Maastricht in 2021 that reviews the different potential mechanisms of plasticity within from psychedelics, and it talks about the molecular level at the BDNF alpha, as well as the downstream effects molecularly, cellularly, with dendritic sprouting, and then forming stronger synapse connections through long-term potentiation. So granted, like this is a review paper. It's kind of going through the potential mechanisms. I think it's to be determined for sure how and to what extent it really works. But from my perspective, if I can identify 3 or 4 different ways to open up neuroplasticity that each have different mechanisms, it allows me to leverage those to get robust functional recovery. And that's what I'm interested in, obviously. I think when I think about how psychedelics may infer function, let's just call inferring functional recovery, not necessarily calling it neuroplasticity. I think that it may have effects at different levels. I think that, for anyone who's ever done a psychedelic, it gives you a different perspective on its own. And I think having that different perspective a lot of times can be really useful if you're going through a really tough time, like just having suffered a spinal cord injury. I don't think that the mechanism of which Jim had some functional recovery after having psychedelics was cognitive. But I think that if you tell someone who just had one of the worst things in their whole life happen to them that they're never going to walk and there's nothing that they can do about it, you know what? They're probably not going to even try. And that potentiates learned disuse. So one of the things that I've always thought, which is why I'm also interested in transcranial magnetic stimulation at the prefrontal motor, at the motor cortex, is that after someone suffers a spinal cord injury, there's less need for those areas of cortex because they can't functionally fire those muscles. And through that disuse atrophy, other parts of the brain kind of encroach on that motor cortex. And so they are less able to fire those muscles because there's less cortex, because they haven't been practicing. In the same way that, Lynn Morano, you're a musician. I grew up playing the piano. When I was 7th grade, my mom gave me the choice to stop playing the piano, and so I stopped. So I stopped practicing the piano, and I no longer have that part of my motor cortex. I can't, I can play a couple songs, I can play chopsticks, but I wasn't using that. I wasn't practicing that motor task, and I no longer have that ability to perform that motor task at a high level. I say that as kind of a comparison. If patients are not in a setting where they're able to practice those motor tasks that they're less able to do, it's really hard to prevent other, neighboring cortical functions from kind of encroaching on that motor cortex. And so if psychedelics can reframe someone's cognition and reframe their situation in a way that gives them a little bit of hope, along with having a supportive, therapy team, along with it working on descending inhibition and activating muscles that were previously paralyzed, that's multiple different levels of approaching someone who just had the worst thing in their whole life happen to them. It gives them, it builds resilience, and then it's also working on the neuromuscular pathway to improve functional recovery. And I think that's super exciting because there are things that can help on multiple different levels, both, with, wrapping your brain around something that just happened that's not supposed to happen, and then also working on a physiologic level to improve functional recovery. I think that's really freaking cool.
I think it's really freaking cool too. Jim, and I'm so appreciative that you brought this out to, despite the very hyperbolic headline and all of that, it did lead to people reading your article and then writing to you. Of the people who wrote to you, did most of them use psilocybin, or were there a range of different substances that had this similar effects for them?
I think that was one of the questions I asked Joel back when we chatted briefly a year ago. It's like, what information might exist on what other substances might be useful, or it seems like I think the answer is it's a big question mark. Nobody knows. Anecdotally, it seems like there might be some differences in the severity of spasticity between different psychedelic substances. I've talked to people practicing some traditional Native American shamanism who pointed towards some shamanic knowledge of potentially different psychedelic substances being used for different types of healing, mental versus emotional versus physical problems. But as far as I'm aware, there's no consensus answer in the disabled community or elsewhere in the medical world.
So when people wrote to you, did they tell you what substance they had taken, or did they just say, I did psychedelics and
I think most of the people are taking either psilocybin mushrooms or LSD, because those are the things that I think are going to be most available and that people are using recreationally. And then some people are having instances of having this like unexpected rehab benefit this in the midst of what was intended to be a recreational experience like mine was.
Yeah, I actually wanted to ask specifically about DMT. And Joel, I know they're doing research DMT for those who have had a stroke because of its neurogenesis properties. Do you think that specifically, that molecule with that property might be an additionally powerful substance for this population?
To be determined.
Okay.
I would just be
totally fair to balk.
I do think that DMT, with its availability to be, I just had a conversation with a colleague up at UC Davis about this yesterday, about it being able, because it's able to be administered intravenously, and there's a quick on and quick offset. I wonder if DMT may be something that is more clinically useful, because from a rolling out and rolling it out to like the general public, because of its quick onset, quick offset. If you can infer the same benefits with a 15-minute session instead of it's much less resource intensive than having two people guide someone through an 8-10 hour session. And so, as I think about how the research we're doing now is going to translate into actual clinical practice, those are the type of things I'm thinking of. But I think the efficacy, to be determined, hopefully. I think there are a lot more questions than there are answers right now, and I'm just happy to be involved in being able to help answer those questions. When Jim was talking, I was just thinking, to me it makes sense to try to get a survey out there for people who have, to collect that data for people who have suffered a spinal cord injury, to see what, and I don't even think it has to be psychedelic specific. I don't think it should be psychedelic specific. Like, what have you used that you found benefit in improving your functional recovery? Or has it helped with your neurogenic bladder symptoms or your neurogenic bowel symptoms? Or has it improved your sex life? These are all things that are really important to a good quality of life. And I think we'll probably talk offline on how we go about doing that.
Yeah, a little background for the folks at home. Jim and I know each other. We met like 2 years ago in Colorado, connected by the people who run Unlimited Sciences, which has a survey of that style for psilocybin, which is essentially like, anybody who's going to do psilocybin, like, basically do it this way, tell us what results you've got so that it can guide future research. They were inspired by Realm of Caring, the people who did the same thing for CBD. And so that's, those people brought Jim and I together. And then Joel has been on the podcast before and is basically my neighbor, lives like 3 blocks away. Somebody sends me Jim's article. My best friend, who is not in psychedelics at all, sends me Jim's article among like 700 other people, which is, like you said, way to go, hyperbolic title. Everybody was very excited about this article. I don't ever get sent anything this frequently. And it was funny because I get sent so many articles that I didn't really pay that close attention until my best friend sent it to me. And then I look closer, I was like, I know him. This is Jim. I know Jim. And so then I asked Jim if he wanted to come on the podcast, and he said, can I bring Joel? And I just thought you guys like went way back. I didn't know this was going to be basically the first time you guys were talking to each other. And so this is like watching a very cool thing unfold in real time, which is like a researcher and a representative of a patient population who's had healing get to have this dialogue. So I just feel very honored to even be in this little Zoom call right now. This is all kinds of crazy synchronicities have brought us to this point. But yes, I completely agree that a survey of this type, psychedelic versus any other type of healing, but there just is in the psychedelic world a precedent for where that kind of survey has led to more research. And so I do hope that you guys, now that you're all connected via our email chain, end up having lots of great progress in this area in the future. Before we wrap up, and I'll throw to Joel first. Is there anything that we haven't covered research-wise, or things that you would like to explain to people or talk about in your field? Yeah.
The one thing that I wanted to touch on that I'm really interested in terms of mechanism for how this may work in patients who've suffered from spinal cord injury is, I'm really interested in functional tractography. So where they're looking at the spinal tracts through functional MRI technology, and they're able to tell the health of those tracts through the imaging. I'm really interested. I would love to do a study looking at functional tractography pre and post psilocybin or another psychedelic. That's, if I had unlimited funding, that would be what I'm doing tomorrow. That's one of the areas that I'm really interested in. I just want to thank Jim for, I think it's really brave to kind of have the autonomy to not only, continue to live your life after, after the deck, after the hand you were dealt looked different than you expected. I think your resilience and your autonomy is a huge part of why you're successful, and it's something I really try and breathe into my patient populations. And I think that's why peer support groups are really, really important, and having a strong rehab infrastructure to help guide patients to, believe that there's hope. And I think that regardless of how hyperbolic the article is, it's something that should be talked about, and it's something that people should know, because too often these are patient populations that are being ignored because it's not as common as something like diabetes or hypertension. And so anything that we can do to shine a light on these patient populations, to get pharmaceuticals to start developing medications that are targeted at opening up neuroplasticity to help patients who have functional disabilities, I think is a good thing. And yeah, I'll stop blabbing. But yeah, I really appreciate you inviting me, Jim.
Gosh, I'm really grateful for your insight and your opinion. I feel like I'm just here on the sample size of one citizen science end of it. So thanks. I hope this isn't too much of I don't want to sidetrack this, but I have a question that I'm really curious to ask Joel, if you have a moment.
The platform is yours.
And that is what, hypothetically or anecdotally, or maybe in the research and the literature, what are there potential downsides to neuroplasticity, or like what would be some of there's such a thing as too much neuroplasticity?
Yeah, I mean, I think that's a great question. I think that when you are, I will kind of quote one of my colleagues who, Emmanuel Lerman, he does a lot of research with vagal nerve stimulation. Neurologist, and double boarded in pain and headache, and just a really great researcher and mentor. Whenever you're changing the connections, of your central nervous system, it may create connections that are maladaptive. And so I think that neuroplasticity is great to leverage when there is a specific, deficit, or something that, when there is clearly neural connections that are maladaptive. And so I don't think just by taking a psychedelic or other medication on its own is always going to be efficacious in solving that maladaptive pattern. But when combined with specific and guided therapy, whether that's physical therapy or psychotherapy or cognitive therapy, I think that's where you can kind of guide those neurons to a healthier connection through neuroplasticity. I think in terms of within the spinal cord injury patient population particularly, sometimes I wonder if it could actually open up, sometimes increased sensation is not always good. And so I wonder if there may be a slight risk of maybe worsening neuropathic pain in some patient populations, or worsening spasticity. I think those are areas where, my radar is up as we kind of traverse into the unknown about this research. But I think overall, psychedelics are safe, and the potential benefit for improved motor recovery, improved neurologic recovery through neuroplasticity, I think it's at least worth researching in a safe way.
And Joel, before we move to Jim, can you tell people where to find you and your research, and perhaps if they have, before we get a survey out, if they have certain stories or anecdotes or similar paths of healing where maybe they should send information?
Going to our website at phri.ucsd.edu, we have a contact tab. We have an email. I don't want to misspeak on the actual email, but it's right on the website. And we're always welcome. I think a lot of times, through those patient anecdotes and through people's stories, it spurs new research ideas. And I think fairly soon you'll hear about a new survey coming out. The Harris survey.
I like it. I like it. And on that same front, since you're looking for funding for this, you said if you had unlimited funding, I'm just saying, dear listeners, if you know somebody with funding who would like to sponsor some spinal cord injury research, phri.ucsd.edu. Did I remember right? There we go. There we go. Because, Jim, you had said maybe we don't have a lot of paraplegic people listening, but we have a lot of people listening who have friends, and they have friends, and perhaps they can share this episode with those friends who may have a spinal cord injury or who may have a foundation that helps people treat spinal cord injuries. So we can get information to places. So Jim, I wanted to thank you for being open about psychedelic use, right? That is not always something that people are willing to share, their use of an illegal substance. And so for you to share it openly in a way that has impacted so many people, very grateful for that. Let's get some funding towards this. Tell us where, any last things that you want to say, and then where can people find you?
I guess one last little kind of harm reduction piece would be, I'm the least medically qualified of the three of us in the call, but also I know that people with medical issues like a spinal cord injury are often desperate for help and are unlikely to maybe wait for clinical research to emerge. And so anyone who is self-experimenting, I would encourage them to maybe start really small, start with small doses, have a friend or a trip sitter there with you, maybe check out some of the mushrooms for beginners guides on the internet. There's a whole lot of them. Do some research and homework before jumping in. Be aware of maybe what contradictions there might be with other medications that one might be taking. Be aware that spasticity might be a factor, might be something that comes up for someone listening. And also I've heard anecdotes of people's body temperature elevating, people becoming hyperthermic in psychedelic states due to or in conjunction with their paraplegia. So those would be kind of my some asterisks at the end of this. Yeah. And also, I'm definitely not a doctor.
I want you to undiscount yourself, because that was the most impressive harm reduction summation I've heard in a long time. That was beautiful.
Aren't I supposed to do that?
That was so good.
I second everything he said. I think that there's a lot of potential, but we have to do the research in a safe way.
Yeah, it was really well said. And I'm going to throw on 6-2 Fireside. If anything, if all of your harm reduction still ends up where you're having a little challenging moment, or you just want to discuss an integration and you don't have somebody with you, remember the Fireside Project can be reached via their app or at 6-2 Fireside. Gentlemen, Jim, no. Where can people find you on the internets and stuff?
I'm most active on Instagram. My Instagram handle is Perpetual Weekend. And if anyone listening has interesting anecdotes about traumatic nerve injury and psychedelics or other therapies that have been really helpful or successful in anyone's recovery, I'd be curious to hear. So please reach out to me at Perpetual Weekend.
Amazing. Gentlemen, thank you very much for this conversation. It was an honor to be part of it. And for everybody else out there, until next time.